Thank you very much. All right, I think Linda's gonna get us started. Linda, if you're ready. And this is gonna be, we're gonna kind of go back and forth.
Sure, I'll get
And
started.
great, thanks. And you guys can feel free. This is, I would say, less formal than our previous segments. And so at any time, please just jump in and we can have a discussion about any of the things that we are talking about. So, Linda, go ahead, you can start, and then I'll just kind of add as we go along.
All right, so we can go to the next slide and see what we have here. Okay, so we just want to explain a little bit about the components of the test plan. And we're hoping that you had downloaded that test plan that we mentioned on day one from the NCSBN site, because that's going to really help you as your study plan for the NCLEX RN. So the NCLEX is primarily based on the level of cognitive ability of the content in the question and integrated processes and client needs. So your questions on your exam are going to address all of those components. The major framework is the client needs, which we'll talk about. And again, your test questions are going to be written to address all of those categories. Okay, so the next slide. All right, so let's take a look at the level of cognitive ability and the integrated processes. So your questions on the exam, these are the levels of cognitive ability. But the questions on your exam are not going to be remembering questions, and they're not going to be understanding questions. They're going to be applying, analyzing, evaluating, and creating questions. Okay, so you're not going to see a question that says, what is the normal blood glucose level? Okay, and you're not going to see, that's a remembering question because you'll remember what the normal values are. An understanding question might be something like the client's blood glucose level is 250. Okay, what does this mean? And it might be, your answers might be high, low, normal, or something else, insignificant. That's an understanding question. You won't see that. You're going to see questions, however, that will say, give you a description of the patient and their blood glucose level, and then they might ask you what you're going to do. That's applying. Or they might give you a description and they might say, you would interpret these findings as, so that's your analyzing question. Or they may have you create a plan of care for a person who's diabetic. Or they might give you an evaluating question that this has happened to this is what the client's blood glucose was. This is what you did as the nurse. This is what your follow-up assessment findings were. And you need to evaluate what happened to that client based on your treatment plan. So those are the kinds of questions you're going to see. Those higher level questions is what you can expect. And that's the level of cognitive ability. The NCSBN has come up with integrated processes quite a while ago, and these are what they identify as integrated processes in addition to clinical judgment. Okay, clinical judgment is expected with every question, but their specific integrated processes are caring. So you want to keep that concept of caring in your mind all the time whenever you answer a question. Communication and documentation. So your communication techniques that Dr. Gray talked about, your documentation skills and techniques. Culture and spirituality might be addressed in a question. So you want to keep that in mind. Your steps of the nursing process, and that's where it builds, clinical judgment builds off that nursing process. And then you might have teaching and learning concepts integrated into a question where you're teaching the client about a concept, maybe diabetes. Okay, so your questions are going to contain those components. And then on the next slide, we should have the client needs. This is the major framework of the test. There are 4 client needs, major client needs: safe and effective care environment, your health promotion and maintenance, your psychosocial integrity, and your physiological integrity. What we want to point out here, and we'll talk about a little more specifics in a moment, but we want to point out here that your physiological integrity section, which is your basic care and comfort needs, your pharmacology and parenteral therapies, reduction of risk potential, and your physiological adaptation. And again, we'll talk about these. This is the biggest, largest component of your NCLEX exam. This will be the largest component. That is why med-surg concepts are priority for this examination. Okay. Now, your second most largest component of this exam is safe and effective care environment, where we have management of care. Okay. That includes prioritizing and all your management concepts, and your safety and infection control. Some of the things we just talked about in this previous session. You can see your health promotion and maintenance and psychosocial integrity are 6 to 12%. We'll talk about what health promotion and maintenance. I think we have slides that talk a little bit more about that, and your psychosocial integrity. So you know, your mental health questions, you're not going to see so many of those. Some of you may not even see any. You might see coping questions rather than an actual mental health disorder question. Okay. And with the health promotion and maintenance, which mainly covers normal pregnancy and growth and development, and some of you may see all growth and development to make up that 6%, may not even see a maternity question. Everyone's exam is going to be different. Okay, next slide. All right, so why is the test plan so important? And we went over this the other day, and here is the link for you. It identifies the content and activities that you're going to be asked about. So the activities that you, as a new RN, must be able to perform so you can provide safe and effective nursing care. So that's why that test plan is so important. It gives you the things they're going to ask you. So what better study guide can you have? And we did throw some examples here for you, put some examples up for you that they have actually in the test plan. Use ergonomic principles when providing care. So you want to make sure that you review those ergonomic principles in preparation for this exam in case there is a question about it. And we showed this to you, I think yesterday or Monday, identifying laboratory values. It actually tells you the lab values that they are going to focus on for this examination. So great study guide for you. If you haven't gone on to the NCSBN site to get that test plan yet, we highly, highly encourage that you do so. Okay. Next slide. All right, do you want me to keep going, Angie? I'd be happy to. Yes?
Sorry, it hovers and then it disappears. It takes me a minute sometimes to get to the mute button. Yeah, if you want to just finish going through the test plan components part, maybe I can pick up after that.
Sounds good. Okay, so here we're back to the safe and effective care environment, one of the client needs components. And it was broken up to management. It had two subcategories, management of care and safety and infection control. So as you can see, the management of care, some of the things we've already talked about, these are some of the major things: advanced directives, the client rights, confidentiality and privacy, really critical, and consents, decision-making, your client care assignments and supervision, and your ethical and legal issues and prioritizing. Now, your comp review book is set up to address all of the activities that are listed in your NCLEX test plan. And if you go to those beginning chapters, I think chapter 6 and 7 of the book, all of these concepts for management of care are in those chapters. So you want to read those, you'll be all set, practice those questions. You can even go on the Evolve site, and we'll show you this later. You can go on the Evolve site and you can select leadership and management questions. You can select prioritizing and delegating questions, and all those questions will come up for you to practice. To get very skilled at that area if you do those practice questions. And your safety and infection control, some of the things that we've already gone over and we've addressed, your safety emergency response plan, I think, did you talk about the emergency response plan, Angela, and triaging and that sort of stuff? I thought I heard somebody talk.
Prioritizing, yeah,
Yes. Okay.
prioritizing, and the different categories, yes.
Okay, I thought so. Yeah, because the security plans and the emergency response plans are very important. Especially in light of COVID that has come upon us these last few years, you will see lots of questions on those precautions, transmission-based asepsis. And there's your ergonomics, handling hazardous and infectious materials, and restraints and safety devices. So those are some of the key things. And again, the test plan lists all of these for you. So plus more than these. So if you have that test plan, again, you'll have it all. Okay, next slide. Okay, I mentioned a few of these to you already. Your developmental stages and transitions, and your growth and development concepts, and your aging process. Now, whenever you see a question on NCLEX that has an age in the question, you want to make sure you pay attention to the age. They normally don't put ages. They normally don't. So if you see it, it's there for a reason. And the reason is they want you to start thinking growth and development concepts, okay? Or they might use the word aging, or they might use the word older, or they might use the word elderly, okay? And if they do use those words, you start thinking gerontological concepts. There is a chapter in the book right before the maternity chapters start. There's a couple of chapters actually on growth and development concepts. And Erickson is one of the priority theories that you want to pay attention to. Okay. So you might want to look at those chapters. And then normal maternity and newborn care comes under the concept of health promotion and maintenance. So normal maternity, normal newborn care. And again, you can get right on that Evolve site. There's chapters in the book, but you can get on that Evolve site and pull up all of your antepartum, intrapartum, and postpartum and newborn questions to help you get proficient with this area. Health screening and risk factors for disease is a biggie. And you'll find that information through the book in various areas. So keep risk factors for certain things in mind, even in the maternity area. Risk factors for preeclampsia, abruptio placenta, those sorts of things. And the techniques of physical assessment, that's another area that comes under the health promotion and maintenance. And there's a beautiful chapter that Angela wrote on physical assessment in that comp review book. So you may want to refresh your memory on all of those sorts of things also. Okay, and then your psychosocial integrity. And as I mentioned before, and as I said with the maternity, there are so many concepts in these 6 to 12% areas that, again, you may not even see a question on bipolar, or you're likely to see suicide, of course, but you might not even see that. You may have all coping questions. You may have grief and loss questions. You may have end of life questions. Therapeutic communication questions. It's just really hard to know what you're going to get on your exam. But these are the areas that are addressed. And you can see also substance use and other related disorders is there. And these are the primary concepts or content areas that they will test you on. So you want to be sure you're proficient in that area, these areas. And then we go to the next slide, which will be physiological integrity. And again, as I mentioned, this is the largest area, client needs area of your test plan. So you may want to start with this area and focus on this as you're getting ready for the NCLEX examination. You can see basic care and comfort is all of your basic sorts of things. Assistive devices, elimination, your nutrition, sleep and rest, and comfort. And then your pharmacology and parenteral therapies. You can see the calculations and pain management. Be sure, and we've reviewed this with you, blood transfusions and IV therapies and your TPN. And that is all in, I believe, chapter 70 of your book, chapter 69, I'm sorry, of your book. So you want to make sure you go through those content areas also. And let's see, your reduction of risk potential. That's where your diagnostic and lab values come in and your vital signs and any complications of tests and procedures. And then your physiological adaptation area. This is also a very large area, as you can see, 11 to 17%. And we've listed here some of the content areas that you will be asked about on your test. But again, that comprehensive review book, again, we designed that, we followed that based on all of this test plan information, and you can find anything in your test plan, listed in the test plan in that comp review book. And we're going to show you later how you can pull questions up on that CD, because we think that that's really important, because we really want you to use the practice question and answer technique to prepare for this examination. And all of you already have that comp review books. You don't need to go buy new resources. That is all you really need for this examination. Okay. We'll show you on that Evolve site that there is a pre-assessment test. If you take that pre-assessment test as the very first thing that you do when you open that Evolve site, it will generate a study calendar for you to help you prepare for the NCLEX exam. So it will guide you as to what to do first, second, and third, and provide you a little calendar of days you should spend on certain things. So we highly encourage that you do that also. Okay, next slide. Let's see what we have. All right, why don't I go over the test design, and then maybe Angie, you can pick up, or I can keep going, whatever you prefer. All righty, so you are the lucky ones. You are in the first column category, NCLEX till April 2023, because starting April 2023 is when all of the case studies are going to be showing up on the exam. So your exam, your scored items will be 60 to 130. So you're actually going to have on your exam, let's see, 75 to 145 as the max. So 75 is going to be the minimum number of questions you have to take, okay? Because out of that 75, if you took the minimum number, 60 are scored, but 15 of those are pre-test unscored questions that they're gathering data on to use on future exams. So that's why the number is 75 as your minimum. You do not know which questions are the pre-test unscored questions. They will show up in the first 75, but you're not going to know which ones they are, because if you knew what they were and you knew they didn't count, then you probably wouldn't spend such more involved time on them. So they don't tell you which ones are the pre-test unscored. So your minimum number of questions is going to be 75, and you will have 5 hours. It will be a CAT exam, which means it's a computerized adaptive, and it's going to deliver questions to you based on those 4 major client needs categories and level of difficulty of the question, okay? If you get a lot of those multiple response questions, don't worry, that's okay. Those are the more difficult ones. A lot of the single 4-option ones are difficult too, but those multiple response are pretty high level questions. Okay, let's see, what else about this? Okay, you can pass this exam at 75 questions, and you can pass this exam if you have to take all 145. So don't be distracted by the number of questions you have to take. I have had students who have gone into this exam, all of their friends had shut off at 75 and passed, And you go in and your question 75 comes up and you go, oh, finally, my last question, because everybody else shut off at 75 and passed. So I'm going to too. And 75, you take it, you answer it, and 76 comes up, and 77 and 78 and on and on and on. Don't worry about the number of questions you have to take, because again, you can, pass this exam at taking them all. There's no reason you can't. You can, the way the test is designed. But what I don't want you to do is when question 76 comes up, you start building anxiety because everybody else shut off at 75 and passed. And now you have to take all these other questions, additional questions. So don't let the anxiety get to you. Sit there and say with every question, I'm doing great and I can do this. Stay positive through that entire examination. Otherwise, it'll get you, okay? And can you fail at 75? Yes, you can. You can fail at 75 too. So I don't want you to think that way. I want you to think with every single question, you're doing great. You're focusing, you're doing the very best you can. You're reading every single word. You're reading every single option. You're thinking it through and you're selecting the correct one, and just keep moving forward and staying positive on that. Okay, any questions so far on any of this? Is there a question there or anything? All righty.
I don't see any questions yet.
Okay, great. Well, again, you don't have to worry about column 2 and 3, so be very happy about that. And actually, it's column 3 and 4 here. And so you don't have to worry about the unfolding or standalone questions. One thing I do want to bring up is that after you complete your exam and your exam shuts off, you may be asked to participate in the NCSBN's research study. It is optional. It doesn't affect your passing score on NCLEX at all. It's an optional thing. You can participate if you'd like. If you just want to get out of there and don't want to participate, then you don't have to. It would be great if you could, because they're gathering data on all of these case studies and the types of questions that they're going to be delivering for this new NGN starting in April 2023. So if you can take that, participate in that research, short research study and answer questions and read the case studies, it would be great if you can do that. But if not, you do not have to. Okay. All righty, let's see what's on the next slide. Okay. Angie, do you want me to keep going? Do you want to do this?
Yeah, I can pick up here and go through maybe some of the practice questions.
Yeah, that's great. Yeah, they'll like those.
Perfect. I think so. There's only a few, you guys. We know we've made you do a lot of questions. We should add up how many questions we have. Maybe you've already done that, but it's quite a bit. So.
Yeah, count them towards their 4,000, right?
Exactly right. Exactly right. Okay, so let's talk about the item types that you guys are going to see on the NCLEX exam. Multiple choice, you guys know exactly what this is. 4 options, and you can only choose one option as the answer for a multiple choice question. And then there is the chart exhibit item type, which will provide a medical record format as part of the information that is in the question. And often there are multiple tabs that you have to click on and look at and go through before you can then attempt to answer the question. And with these item types, the goal is to get you to discern between relevant information and irrelevant information. So somewhat unlike the other current NCLEX style items is that you might have some extraneous information in chart exhibit questions, whereas in the other questions, they're often stripped down of extra details that are not needed to answer the question. So just remember that with chart and exhibit, to prevent you from reading into the question, know that there will be some irrelevant or extraneous information included in the scenario displayed in the chart. And then there's the audio questions. So these are accompanied by an audio clip, such as breath sounds. You might also hear heart sounds or bowel sounds are common audio type questions. We do have audio reviews as part of the Evolve website that accompanies your Saunders comp review, and we can show you where to locate those in just a little bit. And you will be, I don't know, I think they're given headphones. I believe they'll be giving
Yes.
you headphones. Yeah, right?
Yeah.
So you don't have to bring your own headphones. They will give you headphones and you can listen to the audio clip as many times as you would like. And you can even, toggle in between, like you can go back to a certain time point in the audio clip if you want to listen to just a certain part of it, for example. So they'll give you a question with the sound, you listen to the sound, and then you have to answer something about that. And then of course your fill in the blank. Linda's gone over those with you. I think you did 3 practice questions in the last session, and she talked about what you would do there, so I won't talk too much more about that. Multiple response, we've been doing those throughout the review, where these are your select all that apply, where you're required to select one, more than one, or all of the options. And as of right now, the scoring is in such a way that you have to have all of the correct options correct, and you cannot have selected any of the incorrect options in order to get credit for that question. Ordered response prioritizing types of questions require you to rank answers in order of priority. It will either be drag and drop technology, where you drag the response for 1, 2, 3, 4, 5, or there will be a drop down menu next to the question and you put 1, 2, 3, 4, 5. And then your figure or image, also referred to as hotspot types of questions. I mentioned these yesterday. They include a figure or an image, and you have to click on a particular area of that image or of that photograph to show what your answer is to the question you're being asked. And then last but not least, graphic option questions, where you have images or pictures as your options instead of text answer options. So these are all possibilities. The more common ones for sure are going to be your multiple choice and your multiple response. And we have students tell us, or graduates tell us, that in a 75 question exam, they can have up to 30, 35 multiple response questions. And I know that sounds like a lot. It is definitely all the more reason to practice those as much as you can between now and the time that you take NCLEX. Have it be muscle memory, using that approach of, yes or no, yes or no, yes or no. Taking one option at a time is really, really helpful. And just know that if you are getting a lot of those, try to not have that cause anxiety for you, because it is an indication potentially that you're doing really well, because by virtue of this question type, they are the more difficult questions. And if you are getting the more difficult questions, it means that you're doing well and you're probably above that pass line. So, kind of a double-edged sword with those multiple response questions. Before I move on, do you guys have any questions about any of that? Okay. All right, so we do have polling for this question, I think. I set it up myself, so let's see if this works. We're just gonna do, like I said, there's 5 or 6 questions in here, not too bad. And we think you're gonna do very well on these. So let's look at this. In the emergency department, a nurse assesses a client with left-sided heart failure. Which finding would the nurse expect to know? Would it be dependent edema, neck vein distension, abdominal distension, or crackles on auscultation of the lungs? All right, good. Nice work, you guys. An easy way to remember this is left lungs. So if you have left-sided heart failure, a common assessment finding would be crackles on auscultation of the lungs because of the fluid volume overload associated with left-sided heart failure. I will just say here, I don't want to get too much more into med-surg content because I know you guys have probably had it with that. But with right-sided heart failure, that's considered to be more severe because that means that the inadequate pumping has extended beyond the left side, beyond the lungs, now into the right side, and it's probably headed into the rest of the body or the periphery, which is where you would see the dependent edema, the neck vein distension, and the abdominal distension. Okay, those are right-sided heart failure findings. And so with right-sided heart failure, you might see some or all of those, and you may also see crackles on the lungs, but with left-sided, you wouldn't see those other findings typically. Nice work, good job. All right, so we do have another question here where we have some chart information. So if you look at the physical exam findings, we have findings of the mouth, we've got hypertrophy of the gums, we've got pale oral mucous membranes, we have findings of the breasts with appearance of striae, enlarged Montgomery's tubercles, and colostrum secretion. And then we have some fetal heart rate findings, a rate of 135 beats per minute with spontaneous accelerations of the rate. So clinic nurse is reviewing the assessment data on a client who's pregnant. Which assessment finding would the nurse recognize as requiring close follow-up? And then it'll prompt you to click on the physical exam findings in the client's chart. Probably on NCLEX, each of these things would have their own tab that you'd have to click on. Is it appearance of striae, pale oral mucous membranes, secretion of colostrum, or spontaneous accelerations of the fetal heart rate? Yes, good job, you guys. Really good work. So really what I want to talk about with this is this phrase requiring close follow-up, the need for follow-up. This is a really, really common phrase that the NCLEX uses to test. And you want to think of it kind of like a negative event query where you're looking for something that isn't good, right? Something that you need to make sure you're not just noting it and moving on. So the answer is going to be option number 2, which majority of you guys went with that. So that's good. Pale oral mucous membranes could be a finding consistent with anemia and would need to be followed up on. The other things are normal findings in pregnancy, normal and or reassuring. All right, let's see. I'm not sure if the audio will work, but I think it will, so let's try. Emergency department nurse is performing a respiratory assessment and is listening to a client's lung sounds. What sound is the nurse hearing? Okay, I think you guys heard that. If not, just let me know in the chat. And I will go ahead and launch the poll. Is it stridor, rhonchi, crackles, or pleural friction rub? Oh, couldn't hear, huh? Couldn't hear. Dang it. I wonder why. I bet it's my headphones. You have to share your sound. Oh, okay. Hold on.
Yeah, it worked for me when I tried it before, not now.
Share your sound. I don't know what that means.
So it
Okay.
should be under like your More tab, and it should give you options to share your sound or to share your audio.
Share computer sound.
Yeah.
Ooh, okay. Thank you so much. Let me see. It's asking for my password. Please install. Oh. That maybe that did it. I can. Were you guys able to hear it that time?
I heard it.
Okay. Yes. Okay. All right. I do
I
have
can't read the
something.
question though. The questions all
I
are,
know. Same thing here. So
maybe
I'm
go
gonna.
back one and come back.
Yep. Let me try to fix it. But keep that in your mind. Keep that sound in your mind.
Yeah, maybe just go back to that question now and see what happens.
I will. Let me see here. I just lost my screen. Sorry, bear with me for just a second. I don't know if you're even seeing my screen. Let's see.
We are. Yeah.
You are, huh? Okay.
Yeah. Yeah, and it's nice and clear on this question.
Okay. All right, let me relaunch that. It did something weird with the screen. It got blurry, didn't it?
Yeah, it did.
Relaunch. Okay, go ahead and answer that again. Okay, good. Yep, that's Strider. So Strider is the sound that you would hear with upper airway constriction or obstruction. And often what it means is that the restriction in the airway has progressed, starting with the lower airways, like in the lungs, and is now moving up through the upper airway, the bronchus, trachea, higher up in the airway. And so with Strider, it's not a good thing. And it can be an indication of a life-threatening condition. And often you don't need a stethoscope to hear Strider. Sorry, I moved the slide by mistake. You guys did great with that. Linda, can you help me out here? Is this a question that you reviewed in the last section, or is it different?
I did not review this one in the last
Okay.
session. So if they want to try another one.
Okay.
or
All right.
they
Maybe
feel
we just do
comfortable.
it since it's here. We've only
Yeah.
got one calculation question, so we'll give you the opportunity to practice one more time. So let's go through this. Clinic physician prescribes a dose of 200,000 units of penicillin G benzathine IM for an adult client. The label on the 10 ml ampule sent from the pharmacy reads penicillin G, benzathine 300,000 units per ml. How much medication would the nurse plan to administer? And round the answer to the nearest tenth. When you guys are done, please type your answers into the chat for me, please.
Dr. Silvestri, you're muted.
Angela, are you there? You're muted.
Oh, shoot. Sorry, guys.
It's okay.
My sound has been weird ever since I did that audio thing. So it's like really hard to hear.
Okay.
But I'm gonna try to switch from my headphones and see if that doesn't help. Okay. Can you guys hear me? Just give me a.
Yes, we can hear you.
And I can hear you much better now. So I think we're good to go. Okay, so I will repeat all of that. This is the formula that I like to use, and I see your guys' answers here in the chat, and that's good. You guys got this correct. So good job on that. So it's desired over available times the vector, which in this case is milliliters. And so if we have the prescribed dose of 200,000 units over what's available, which is 300,000 units in 1 ml. So you can see how that's set up, and that's 0.66, and we round that to 0.7. And one thing I just want to mention about the dosage calculation questions is that you always need to think of this in the scenario. So you've got a dose of 0.7 mLs and you're planning to give it intramuscularly. So a good double check is, okay, is it realistic or feasible for me to give 0.7 mLs IM? And the answer to that is yes. But, if you ended up with, like 7 mLs, for example, that wouldn't make sense given the route that is specified in this question. So it's a good double check to look back at the route, even though you don't necessarily need to know that information to answer the question. But always asking yourself, does it make sense? Okay. Gabriella's gonna give me some tips here. Yeah, thank you. I think that's what it was, Gabriella. I appreciate it. I stopped sharing the sound. Okay, so next question is a multiple response question. And for this one, I set up the polling a little bit different. So I'm curious to see if this is going to work or not. And I think you guys will know the answer to this because it's about aneurysm precautions, which we went over yesterday. Okay, so aneurysm precautions are prescribed for a hospitalized client with a cerebral aneurysm. The nurse would take which actions to institute these precautions, select all that apply. Administer stool softeners, restrict the number of visitors and keeping visits short, keeping the room well lit, especially during the daytime, encouraging restful activities such as listening to quiet music, encouraging the client to dress in street clothes and shoes every day, and allowing them to perform activities of daily living, including bathing and dressing independently. So let's see. Okay. So I think the select all that apply worked. Looks like it did. And we are liking option number 1, right? Administering stool softeners to the client. Yes, that's going to help to prevent constipation, which is one thing that could put them at risk for rupture of the aneurysm. And then option number 2, this is a good idea, you know, as much as we do want them to be able to see family and friends, we do want to keep the visits short and restrict the number of visitors because it can be very stressful to have large groups of people there, and there can be a lot of stimulation. So option number 2 is a correct answer. Keeping the room well lit, especially during the daytime, that, you know, that's a good thing to do, but not for somebody on aneurysm precautions. It is a good thing to do for people that you're trying to get them kind of up and moving and get them out of bed. But for aneurysm precautions, we want the room to be kind of dim and quiet. Encouraging restful activities such as listening to quiet music. Yes, you can do that as long as it's restful. The music's not too loud. It is promoting relaxation. That's a good thing to do. Street clothes and shoes every day. No, that could be stressful for somebody in this situation, as well as option number 6. You know, again, it's kind of like option number 3. Like in general, normally, yes, we would want to do that. But in a case like this, where we are trying to prevent a complication associated with that might be associated with stress, we may need to help them with their ADLs. You guys did good. Let's see what we've got next. All right, so this one we don't have polling with, so we can just kind of talk through this. This is an example of an order response question. So it reads, a nurse preparing to suction a hospitalized client who has a tracheostomy tube gathers the supplies that are needed for the procedure. Arrange in order of priority the actions the nurse would take. All options must be used. Pay very close attention to that part of it because it could say not all options need to be used, and in which case you could leave some over on that left side and not use them in order to get the answer right. So they'll be mixed up on the left side. You'll have to order them correctly. And then you can see here how it's ordered in the correct way, 1 through whatever. So in this case, place the client first in a semi-Fowler position, don gloves, attach the suction tubing to the suction catheter, turn on the suction device, set the regular at 80, hyperoxygenate, insert the catheter into the tracheostomy until resistance is met and pull back 1 centimeter, and then apply intermittent suction slowly while slowly withdrawing the catheter and rotating it back and forth. These question types, I don't think we're going to see moving forward so much, but you guys still might see them. And they often are about nursing types of procedures like this, like suctioning, for example. Okay, next question. Nurse is changing the abdominal dressing of a client who has undergone abdominal surgery. After removing the old dressing, the nurse assesses the surgical site. Which action would the nurse take first? The nurse is going to document the findings, apply a sterile saline-soaked dressing, redress the incision site with a dry sterile dressing, or assess the incision site for protrusion of internal structures by asking the client to cough. Okay, so this is a figure image question, right? And so you have to look at this and make a determination as to what you think is happening. Type in the chat for me. What do you guys think this is? That's the first step in answering this, to figure out what you think it is. And then from there, you have to figure out what you're going to do. Yes, Monique, thank you. Dehiscence. This is showing opening of a surgical site. Yep, I think that's how you spell it, Nick, too. You guys did good. So what are you going to do with this? It looks like this might be an area for you guys to review just a little bit. But you're not going to just document. I'm glad you guys didn't want to go with that. You do want to apply a sterile saline soaked dressing. And then so what that's going to do, if you do a sterile saline soaked dressing onto the site, it is going to keep the underlying structures moist so that they don't dry out. And it's also going to protect them from anything in the environment that could predispose them or lead to an infection. If you were to redress the incision site with a dry sterile dressing, that could cause damage to those underlying structures because of the fact that the dressing is dry. And then assessing the incision site for protrusion of internal structures by asking the client to cough. So the first part of that is absolutely correct. You do want to assess for protrusion of internal structures because that could indicate that the dehiscence has evolved into an evisceration. And that's the differentiating factor, is that internal structures or organs are protruding in evisceration. But by asking the client to cough, you definitely don't want to do that in this case because it could cause that. So that is going to leave you then with option number 2. This is something that needs to be taken care of right away. And they are going to probably have to go back to the OR to have this closed up again and, you know, for further assessment too. All right, let's see. I believe this is our last question of the day. Nurse is caring for a client with small bowel obstruction and is preparing to insert a nasogastric tube for gastric decompression. The nurse assists the client to which position for the procedure? Option 1, 2, 3, or 4. Yes, nice job, you guys. Good work. So option number 1, this is a Fowler's position. This is the position that they need to be in to facilitate the insertion of a nasogastric tube. So, and you don't even need to know that it's for what gastric decompression is. You don't need to know what small bowel obstruction is, but this gives you an idea of what the graphic option items look like. Did great with that. Good job. And what you do want to do when you see these is try to determine what these different positions are, right? So, you know, you go through, okay, option number 1, that's a high Fowler's position. Number 2, you know, that's Trendelenburg, semi-Fowler's, reverse Trendelenburg. If you're able to do that, that might help you. Okay, so the next portion of the presentation, Linda, I don't know if you wanted to pick up here, you want me to keep going?
Whatever you'd like is fine with me. We can go back and forth on them. These are some questions that current students and students in the past have asked us. So about the exams, we thought that we would present them to you and address them and see if you have any additional questions about this or anything else. So, do you want to start, Angie? Do you want me to start?
I can go through this first one if you like.
Sure.
So the first question that we've gotten quite a bit is there a chance of seeing COVID-19 related questions on the exam this year? And this question actually came to us during the time that COVID was really starting. And so at that time, the answer that we had to that question was probably not. Probably not, because everybody's getting up to speed on this and writing about this, and we're learning about it right now. And so probably you won't be tested on it. And now that we're starting to come out of the pandemic, we're mostly out of it at this point. Although here and there you see reports of upticks in cases. But certainly in the near future, we're going to see questions related to COVID. My suspicion, though, is that it's not going to happen until the release of the new test plan, which is not going to occur before you guys take the exam. NCSBN has said, though, and this was guidance for programs of nursing, was to be sure that our training and preparation on infection prevention measures is good, but that was really from the perspective of preparing you guys for practice and less so in preparing you for NCLEX. And so I think that it's not going to be until the release of the new test plan. Linda, I'm not sure if you have differing thoughts on that, but we haven't gotten specific guidance one way or the other on this that I know of.
Yeah, I agree with everything that you're saying. And one of the things to remember, now you may see a question, maybe, but one of the things to remember is that things really are still up in the air about a lot of information about COVID-19. The CDC is, constantly changes things. And so anything of that nature, you're not likely to see on the exam if there's any controversial or still being researched to make decisions on certain things. So if you do see anything that has a diagnosis of COVID-19, it's going to be those general known facts that older people and people with pre-existing conditions are at higher risk, that we need airborne precautions, but they're not going to get into anything that they're still just not really sure about. We're still learning about COVID-19. So it would be that sort of thing. And I think somebody had a question in chat about it.
Yeah, that's a really good question. Because Salma was saying that there were questions on HESI that were related to COVID. Does that mean that they could come up on NCLEX? And my thought on this is that publishing companies like Elsevier and testing companies like HESI are trying to be ahead of the game with this, and undoubtedly it is going to be on NCLEX in the future. Like, there's no question in my mind about that. And I think that HESI is trying to be ahead of the game, and probably they are piloting these questions right now. That's just a suspicion. I don't have any way of confirming that, but I think that's probably what it is. What do you think, Linda?
I agree. I think that's exactly what they're doing, is that they're piloting test questions. And HESI does item analysis on their question and to determine whether they can use them in the future.
Yes.
And if they're good and valid questions. So they're probably pilot tested questions. And again, I think if you do see anything, it's going to be very general, and it's just going to be commonly known facts that we know so far.
And I think, Salma, if you see these questions on NCLEX, I think they're probably being piloted too. That's what I would venture to say, given the time of when you're going to be taking it. Okay, so next thing that we got a question about was, will fully compensated and partial compensated with ABGs be on the NCLEX? So this is a possibility. You could be asked about ABG interpretation. The question could give you information on the values specific to what's going on with a certain health condition, and it could give you the ABG values and ask you to interpret what that means, and then further probably what you're going to do with it, right? What actions you need to take. And then as far as the compensated piece of this, fully compensated, partially compensated, my thought is that it would be less likely of a scenario for you to encounter something specific about the compensated aspect of this, but it would be good for you guys to know about that and to know, what's considered fully compensated or not. And really that has mostly to do with the pH level. And if the pH level has returned back to normal range, but then other values are still off, or if the pH value is still abnormal and the other values are still off. So take a look at the acid-base balance chapter. And we do also, Linda, correct me if I'm wrong, but I think we've got an audio review for this too in the book.
Yeah, there's an audio review in Evolve on acid-base balance. And there is a nice box chart in that acid-base chapter that teaches you the steps, shows you the steps to go through to determine what disorder it is, and if it's compensated, partially compensated, or uncompensated. So yeah, look at that box. That will help you. We've tried to make it very easy to figure out.
Yeah, good. Thank you. That's great. Please just stop us at any time if you guys have any questions. Otherwise, we'll press on to make sure you get out of here on time. So are the practice questions here at the same level of difficulty as the majority of the questions on the NCLEX? So this question was being referred to as the few questions that we went over in this presentation. Is it the same level of difficulty? So in this particular presentation, those questions were not as difficult as what you're going to see on the NCLEX, because we were showing just the item types is what we were illustrating there. But the questions that we went through during this 3-day live review, the level of difficulty will be similar on NCLEX. So if you did well during this time, then that is a fairly good indicator. But what's going to be an even better indicator is going to be your last CAT exam on Friday. So definitely go into that exam, try your hardest, study tomorrow. And then if you do really well, you can just feel good about taking the exam, and your confidence will be higher, which is going to help you on that day. Okay, and the select all questions, can there be only one right answer, or must there be more than one? Linda, I think you answered that before. Do you want to take that one?
Sure, yes. For the select all that apply question, or your multiple response, is another term for them. There can be only one right answer. There can be more than one. There can be all of them can be correct. So yes, there could be only one right answer. Which makes it more difficult.
Even more challenging, right?
Yes, they are. Yeah.
They're hard. Okay, so can you clarify the math rounding? I think Linda went into that pretty extensively.
Yeah, and there's also I think there's an audio. I think it's an audio. It's on the NCSBN website in Pearson View, and they provide you with a video maybe of rounding and their guidelines for rounding, and they'll tell you what their guidelines for rounding are.
Nice, yeah.
And what they're going to tell you is always round at the end of the calculation, not along the calculation. Once you
Mhm.
finish calculating, that's when you do your rounding up or down. Okay.
That's helpful. That's helpful.
Yeah. And there, it'll be obvious which way you have to go. So it'll be clear enough.
Yes, great. Okay, and then what book is the top 100 medications? And that's going to be in your orange comp review book. In the very back of the book, you will find that. So definitely take some time to look that over. In terms of lab values, every book seems to give different normal values. Where would you suggest to get the lab values that NCLEX would be using as norms? So as we saw on the test plan on day 1, the NCSBN does not specify the reference ranges as of yet. We are anxiously awaiting that information. They only say which lab tests might come up. And so we would suggest using that lab document that we showed you and study those normal reference ranges. And we would also say that if you're being tested on the ability to interpret a lab value and determine whether it's normal or abnormal, it will be grossly abnormal if that's what they're trying to interpret. It's not going to be, like 1 point or 0.1 off or whatever. It will be grossly abnormal. So just keep that in mind and try not to get too hung up on these very minor differences. And the reason for this is that every physical actual lab has different equipment that analyzes the samples that are calibrated in a slightly different way, which is why you have those slight variations. All right. And on average, how much time do we need to spend per question? Linda, would you like to address that?
Yeah, they're not going to time you on the question. In other words, the question is going to come up on the screen and it's not going to disappear after a minute and a half or whatever. Okay, so I would.
I want to come up under my name too.
Pardon? I missed that.
Sorry. I got it. We're good.
Okay. So, I would say just read your question, move along at your steady pace. Don't compromise how you're going to answer that question because you're worried about time. Normally research says that all you really need is a minute per question. But you can spend, if you take 5 hours and you've got 145 questions as a maximum, you can figure out how much time you will have for each question if you want to spend that time on it. Some questions aren't going to take you so long. Some questions you're going to have to read 3 and 4 times to really get the gist of it and what they're asking you. I think when you're practicing on the Evolve site, if you find you are someone who is having trouble getting through the exams, time yourself. And if you're having trouble getting through the 100 question exam, allowing yourself a minute and 15 seconds per question, then you need to try to work on, increasing your speed without affecting the quality of how you're answering. So maybe a minute and a half per question. But don't worry about the time. Don't be timing yourself, trying to figure out, okay, a minute's up, I got to keep moving here. Just focus on what's in front of your screen and do the very best you can. And don't worry about that. I don't know if you have, Angela, but I have not heard of many people at all who've run out of time at the 265 when they used to do that.
Yeah.
So you should have plenty of time for this exam, plenty of time.
I agree. And if that is a concern for you, and let's say you're somebody who has accommodations for extended test taking time in school now, then I would highly recommend that you get that process started. And our DRC here, Dina Leland, can help you to work with the board to get that in place for you for NCLEX as well. So that will help with the anxiety piece. And if you're somebody who has those accommodations now, I would definitely carry those through to NCLEX, although I do think 5 hours will be plenty of time, but just to be on the safe side.
That's a great option. Yes.
Good. Okay. And then this part here, I'm struggling with questions where they're multiple choice and all of the answers are correct, but it's asking for the best answer. You know, I'm hoping that throughout this 3-day live review, you guys have gotten lots of strategies to help you with that. But I think the most helpful thing for me with this is that just telling yourself that the answer is here. Okay. Like the answer is here. It's not jumping out at me, but let me just take a minute and I'm going to just break this question down. Break it down into little pieces, use your whiteboard, write things down, make connections with parts of the scenario that's being presented to you, the question that's being asked of you, and the options that are listed there. And then of course, always using the process of elimination. But I mean, no question is exactly the same as another question. Each question is going to have little nuances that you're going to be expected to pick up on. And so that's why it's so important to do so many practice questions so that it becomes a skill that you have acquired. Anything on that, Linda? Is that it?
No, that was perfect. That's great.
All right. So I think we've got just a couple more slides here on the questions from students. So can we talk about COVID and if it's considered droplet or airborne? So this was like way back when we were like, we don't know what this is. We know what this is now. We know that it's considered airborne precautions. When do we get the results of NCLEX? So there are a couple of ways that you can get your results after you take your NCLEX exam. You will get the results mailed to you, but that takes a couple of weeks usually. And you also are notified via your state board of nursing. They will send you the results as well. That's actually, I think that's what ends up being mailed. I think the state board of nursing is who ends up mailing you that result once they're notified by the NCSBN. There is another quicker method that you can use. Linda, is it through Pearson VUE that they do that?
It's either Pearson VUE or the NCSBN. They're connected. So yeah.
It's called the quick results. And you can go online and opt to do the quick results. I want to say it's like a $7 fee or something like that, where
I think it's 10, something like that.
Yeah, so you go in and you enter your information. It's all done through the same portal that you use to register for your NCLEX exam. It's 48 hours after you take the exam. Typically those results become available. And once you pay the fee, it will just, a pop-up will come up and it'll tell you pass or fail. And then we don't need to worry about next generation questions. So I think we'll skip that one. Is there a certain percentage on the exam? So the way that I interpret that is like, can you get 100% or a 75%? And so with the computer adaptive technology, the answer to that is no. It uses a pass line, which is actually really intricately integrated using psychometric technology and adaptive technology. So with the pass line and the way that the questions are coded and the way that you are performing on the exam is what determines what they call a pass-fail decision. And so if by the time you hit that minimum length, if it's a clear pass-fail decision that the computer is able to make about your performance, then you will get that result. If it's unsure, it's gonna continue. The exam will continue until they're able to make that determination or until you run out of time. Did I forget anything on that?
No, that's great.
Okay. And then, so essentially same answer to this. How does the exam determine the amount of questions overall? The better you are doing, do you get less questions? So that could be one scenario, but it could also be that somebody is doing so poorly that the computer is able to make a decision about their performance in less questions. So it really could be one way or the other. All right. Is there a tip for the questions that state what to do first? Do a task procedure or call the provider? Both seem important, but when do I choose the task versus contacting the provider? We talked about when to call the provider, when not to call the provider. Often that's not a correct answer on the exam. So I would just carry that with you, unless this is your gut instinct, this is the option that you want to go with. There really isn't anything nursing within your scope of practice as a nurse that you could choose as a viable option. Would I then choose that? Or if it's a truly emergent, situation that's being described. How can I master delegation? Well, I'm going to say practice, 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 lots and lots of practice questions. And we do have practice questions on delegation. So you guys want to look at that for sure. I don't think we're going to talk about this one about failing the test because nobody here is going to fail the test.
That's right.
Right?
Right.
But just know you're not alone if that does happen. And I want you guys to reach back out to us if that does happen. But right now, put that out of your mind because you're doing everything that you need to do to pass. I wonder if the HESI exam is as hard as the NCLEX. So we talked about HESI and the research that they have, their item analysis that they do, and the predictability data that we have. So if you are performing 900 level or above, you have a really high chance of passing NCLEX on the first attempt if you perform similarly on the NCLEX as you did on that exam. And so yes, these exams in terms of level of difficulty are similar. I struggle with physiological integrity. What tips could you provide on how to improve on this content area? So physiological integrity is the majority of what you're going to be tested on. And so you got to go in and just do that content, do practice questions in that area. This is med surg and pharm for the most part. So that's what you want to focus on. Okay, so we talked about this and I know we're getting close to time. So what I want to do here is we already talked about this. So I'm going to actually stop sharing for just a second because we want to show them evolve really quickly, Linda. Yes?
Yes, definitely. So they have some guidance as to how to proceed with studying.
Yeah. So this won't take long, guys. Hang in for just like a couple more minutes while I pull this up. So again, this resource is going to be associated with your Orange Comp review book. Okay. All right. Almost there. Evolve resources for the NCLEX RN 8th edition. Where is it? Share screen. There we go. Okay, so this is what you're going to see when you click on that in your Evolve account. You go to exam review. And this is what's going to come up. Are you guys seeing this?
Yes.
Okay. So then this explains all of the features. So it would be worth your while just to kind of take a quick read through this. But if you click continue, this assessment test here, the 75 question practice test, you have a pretest. So you can click the pretest and do the pretest in here. And this is what will generate your study calendar for you. Okay, once you take this pretest, and it will tell you in what areas within this program you should focus. So highly, highly recommend that you do that. Once you do that, then you will be able to take this post test to see where you have improved. All right. And then study mode. So study mode, this is where you get practice questions and rationales immediately right after you answer the question. So if you go into study mode, you could do it by test plan category. These are your major categories here. Cognitive ability, we don't usually have students accessing in that way, but certainly you could do that if you wanted to. Content area, so here's where you can be more targeted towards what you need to do. There's adult health, right? So then all of your body systems, you can do it that way. This is going to be med surg. Complex care, same thing. So just kind of peruse through here, take a look and see what areas there are. Here's your leadership, so you're delegating it, supervising, and other leadership things. Prioritizing is here. Maternity, mental health, and peds. Spend a little time, but not a ton, right? You might get three questions or so in those areas. Pharmacology, and pick the ones that you're weakest in based off of your pretest. And remember, you can drop down further to drug class if you want to. You can also do it by health problems. So if you know that you're weak in, let's say, heart failure, okay, you can do some practice questions specific to that. And then these others here, I wouldn't worry too much about those right now, but alternate item formats, here's where you can do your multiple response questions. That your select all that apply. You've got 707 questions you can do that way. You can go into exam mode too if you liked, which will mimic, the way that it's going to be on the NCLEX, where you're not getting rationales at all. You can get them at the end if you want, and you can do 10, 25, 50, or 100. These are kind of mini case studies if you want to do those. They're going to help you. Definitely wouldn't hurt to do those. Same with the next gen questions, the NGN questions. And then here's your audio reviews. So your acid base balance, fluid electrolytes, and we do have a pharmacology review as well. Anything else, Linda?
No, that really gives them good direction.
You guys have any questions about this? And you do also have access to HESI Compass as well. So if you prefer working in HESI Compass, that's perfectly fine. You have a couple of options. As you can see, you've got plenty of resources. So I don't think you have to go out and purchase anything else with what you have access to. Okay. We're 1 minute past. So I'm going to give just one more opportunity for questions. Please let us know if you have any. And a final reminder, please, about your posters. I need your posters. I'm still missing 2 groups. Thank you to those who have sent theirs. I really appreciate that. I want to check it off my list. And with that, I want to thank you all very much for a wonderful review. Spring 2022 graduating students, this is very exciting for you. This is another milestone for you all. And you are almost there. You've got CAT exam, poster fair, and then you're celebrating.
Congratulations, everyone. You should be so proud.
Yeah, this is a huge accomplishment.
It is.
There's not many people that are able to do what you all have done. So congratulations to you on that. Thank you, Linda. Thank you, Devin, for your help and your support. We couldn't.
Somebody has a question about pinning.
Evelyn, before this was unlimited, and I want to say it's unlimited again now. During COVID, we had some limitation. To know for sure, double check with Elizabeth, because she's the planner for that, Elizabeth Gardner. All right, you guys, email me if you think of any questions. Thank you, Devin, for putting Elizabeth's email in there.
Thank you, Devin, for all your help. And thank you, students, for being so great these past 3 days.
It's been great. Thank you all. And I am going to send out the links by the end of the day today, hopefully, if not early tomorrow. All right, guys, happy studying. Make sure you study tomorrow. Okay.
Congrats, everybody.
Thank
You
you.
did great.
Bye-bye.
Bye.